okay. I think I overdid gluten and paid dearly for it, but now I feel totally back into my usual energetic self. But it was a good lesson. Okay, the holidays, your body doesn't care whether the consumption of inappropriate foods for you are on holidays or not. So with that in mind, let's do the COVID first. This is a more general updates on situation with the respiratory viruses. There's a lot going on. It's interesting that my prior predictions are coming true 100%. We're not seeing any RSV. It's completely plateaued and nobody sees any cases, at least locally, we're not. So just as I thought vaccination for RSV didn't make sense for most people, so I'm just gonna stand on that this year. We'll see what happens next year. Flu, on the other hand, is just now starting to come in with vengeance, being a bit late this year, but it's coming. Again, sort of, I predicted that. And then, of course, as we talked about, the COVID is spiking massively everywhere. We just had Ashley come down with yet another round of COVID. She's at home, of course, isolating. And in the last week, we probably had 7 or 8 cases in the clinic. I expect major flare in the next week or two, as nobody was masking, people were traveling. And this particular strain we're seeing is called JN1. It's the kind of this, well, it's not new. I already mentioned it. I think I mentioned it right at the last session we had, but now it accounts for more than 40% of all the cases in the US. It's also predominant strain in Europe. Seems to be a little different than the one before. It's still an Omicron variant, but it's a pretty unique variant in that it seems to generate almost exclusively kind of a sore throat and upper respiratory symptoms without muscle aching, with not much taste and smell loss, not much of other thing, except some patients get GI symptoms. But most people will have first symptom being a sore throat. So if you are experiencing that, it's not a flu, it's not RSV. If your first symptom is a sore throat, most likely you have either COVID or just whatever else. There's some other URI, upper respiratory infections that are coming around left and right. So you have one of those two things. Also important, notice the standard tests that we do at home seem to catch it, but not immediately. A lot of patients reporting that they will do the first test at the moment of sore throat and it comes back negative, just to be grossly positive a day or even a couple of days later. So do pay attention. If you did one COVID test, it means nothing. Make sure you do at least one more, and then also do it at least 24 hours later. So as you kind of deeper into the symptoms. So make sure you have a couple of tests at home at least. You can still get the free ones, surprisingly. I thought that they're no longer doing it, but you can still get them. It's the same link. If anybody wants to try to find it right now as I'm talking, by all means, do that and post it in the chat as usual. So that is all for my current COVID updates. I have no updates on vaccines. If you're normal risk, meaning you, even if you're 65, if you don't have particular lung disease, that and I don't recommend RSV vaccine at all, even if you're 70, but you don't have lung disease, I don't recommend it for now, just because I want to wait, and currently it doesn't seem like there's any RSV or very little of it, so I think the risk is low. I'm much more advocating for COVID vaccine if you've been for more than 12 months without either acute COVID or vaccine. You probably should consider getting it if you're 65 plus. If you're not and you don't have any chronic diseases, it's your call. I'm not sure it's as essential to get vaccine if you're younger, just because I think the risk of any serious long-term complications, and remember that the vaccines don't prevent actually getting COVID, they minimize risk of severe COVID. So with that in mind, just that's why I'm not changing recommendations. Question is, should you get a flu vaccine now? If you haven't had it and you're worried about it, yes, please do go get the flu vaccine. I think it would be helpful. Flu is, even though it's coming now, and remember, if you ask me the same question, should I get vaccinated in February and March? My answer would be absolutely not. because by that point, the flu virus will completely mutate and your vaccine is going to have zero protection. It's just not going to work at all. It'll be already as if it's a new strain for the next year. So you're only going to get some protection if you get the shot right now. Getting it late in the season is going to give you almost no, or I mean, you'll still get some protection. I think I misspoke. You're going to get a little bit of protection, but that percent protection is going to be much lower than getting it earlier for the period between now and the spring. And then in spring, you're going to have higher chances of getting it no matter when you get the vaccine. Okay, so with that in mind, I'm going to turn my attention to questions, and then we'll do the wellness talk, which I'm doing today too. Okay, so Benit is in New Jersey. What are you doing in New Jersey? It's a joke.
Hi. No, I work fully remotely. So I moved back home.
Okay.
Well, I pay DC rent.
I was trying to make a bad joke, but then I
I
realized maybe
know.
somebody is from New Jersey, and then I should shut up. I lived in Philly for a long time, so usually people who live in Philly will joke about people from New Jersey as they drive slow. Of course, it's not a real joke, but it's a joke. All right.
No, Jersey jokes are
Yeah,
not allowed.
so you have what? Oh, just a cold?
No. Oh my God, I had the sore throat and the GI systems hit me hard yesterday. And
Well,
I was
it
just
could,
like,
believe it
what
or not,
the?
it could be something else.
I hope it's something else. But my sister works at a hospital. She and her coworkers, they did not get the booster. None of them have been getting boosted. She has been coughing like crazy. Dad has been coughing like crazy. True, we just got back from the cruise 2 weeks ago, and all of us got sick. I actually wore my mask pretty much the entire time on that cruise. But as soon as we landed back into New York, oh man, like everyone was starting to get sick. But I was just like, I know a lot of people who've never had COVID are getting this variant. And I've been reading about how the GI symptoms are like really bad. And yesterday I was just like, oh God, please don't tell me that like my number's up and I finally have it. So, I will get tested and confirm that this is in fact the case. Whatever this is not fun at all.
Yeah, so I'm guessing that you've got it's probably there's so I've seen several people get that when they get this kind of a weird cold with the GI. Now it could still be COVID and you may have multiple tests negative. So I would definitely recommend you keep testing periodically, like if it doesn't go away, especially. But I mean, chances are this is just some viral infection that gives you both sore throat and the GI, which is
I've been
very
getting that for the last 3 years. I mean, I thought it was Delta, and actually it was a sinus infection. So I'm assuming maybe it's just a sinus infection. We have a lot of respiratory illness going around in this area. Like CDC actually flagged New Jersey and New York specifically because it's that bad up here. But up here, I don't know how it is in DC anymore, but up here, hardly anyone's masking, even now. I mean, I've seen
a
more
lot of
people, but
people. I mean,
a
I
lot
would
of people
tell
are
you
not masking.
for each COVID patient, we get like 3 calls that is just like what you have, like non-COVID general virus. That's nothing, no RSV, not flu, not COVID, and it's bad, just severe. So unfortunately, bad cold season. And everybody says that. Now it's interesting that it missed all the estimates. Everybody was saying it's going to be RSV and flu. And there's flu, we may still get a lot, but mostly we're not going to get RSV.
We're seeing mixture, flu and this variant. But this
Really?
variant is definitely very prevalent up here.
Huh.
Everyone up here is sick right now. It is so bad.
Yeah, according to CDC, I was just reading, they're basically saying flu season just started, like
Right.
literally as of January 1st, that people were not seeing a lot of flu until now, which is unusual. Usually flu sets in late November, maybe early December, but not early in January. That's really delayed. Well, thank you. Thank you for that. Any questions?
Hi there.
Hi.
This is my first time joining this, so forgive me and feel free to veto the question if it's something that's already been discussed in previous sessions. I guess I was just curious about maybe just a brief overview of what is known about the long-term effects of COVID versus other respiratory diseases. I've heard that, COVID is, more than just a respiratory infection. It's, a vascular infection, or, it involves many more body systems. And I guess I was just wondering about right now, what is known about what those longer term, more serious effects of the infection are.
Well, Sharad, welcome, first of all, and it's actually a very, very good question. In fact, it was a question that I was contemplating just discussing today, period. It's just that the JAN one felt a bit more acute. That's why I decided. Important point on this. So the long COVID, which is what you're aiming at discussing, it's a unique situation. Now, there is a new information coming out claiming that even flu can cause this. And we always knew that there's a pretty much after any virus, you can have prolonged illness. What makes the COVID unique is that for whatever reason, the consequences of the prolonged post-viral prodrome seem to be a lot more severe, and they seem to be a lot more global. All organ systems can be affected. We're particularly seeing an instability of autonomic nervous system, which often manifests in something called POTS, postural orthostatic syndrome. And the other bigger pieces are people tend to have a lot of cognitive problems, severe fatigue, and long-term breathing difficulties. Yesterday, we had a new patient at the clinic, is a 21-year-old who's unable to walk a block. And he had a very mild COVID with almost no symptoms, and then very gradually developed one of the most severe post-COVID syndromes I've ever seen. Why that is, Sharad, we don't know. So we don't know exactly what drives this. We know some pieces, and we're gradually learning more. As you exactly correctly pointed out, the vascular component seems to be very, very important and kind of unique. Flu does not seem to do that. Other standard respiratory viruses seems to do not trigger significant long-term vascular inflammation. Why? I think researchers know a bit more than I do. I kind of look at this a bit more practically. If it doesn't help me practically address a particular issue, I tend to not spend a lot of time researching this. So you need to understand that I'm biased at how I look at the data. So I don't look into certain things in a certain way, but mostly because, mostly because in this group, we tend to keep things a bit more practical rather than academic and research-based. We do have a very large long COVID group in our clinics just because the demand is very high, and we have a lot of people who really are unable to be taken care of by a standard system since they don't offer any treatments, basically. We do think that the treatments that normalize central nervous system and dampen down the hyperexcitation of the nervous system are very important. They seem to be 50% of the fight. So things like meditative practices, acupuncture, certain vitamins that support nervous system, cannabinoids are very important. So those things tend to kind of help people to balance the central nervous system. And if somebody has a very severe mitochondrial dysfunction manifesting as severe fatigue, we are actually trying something new. And I was going to discuss this in the next week, and I'll probably spend a bit more time in the future on this. I'm going to type this. We talked in this group about boosting NAD levels. NAD is a molecule that's produced as part of our Krebs cycle. So every second or every millisecond, we produce millions, if not trillions of, actually, I don't know how many, somebody could look it up, molecules of NAD in the body in every cell. So the NAD is what is driving all the energetics of our body. And it produced from food, whatever you eat tends to metabolize through the Krebs cycle into this molecule. And it's very clearly known that with chronic fatigue, post-COVID, post-mono, post-whatever, the NAD production drops. NAD production drops with aging, and of course, all NAD boosters are now number one senolytics. I was presenting in a long COVID group a little bit about this a couple of days ago, and they all asked that I actually talk about senolytics. So I'm wondering if there's an interest for me to talk about this in this group. Senolytics are agents that slow down aging. There's a lot of research on this. I can definitely present like a 10-15 minute concentrated talk on senolytics that are most evident. So I can't cover all of them. There's probably about 24 of them. Kathy's 2 thumbs up. Okay, good. All right. So, well, if Kathy gives 2 thumbs up, I have to do it. All right. So we'll do senolytics at some of the future events. I don't know when exactly. I have to organize it a little bit. Otherwise, I think you'll be able to disjolt it. It's a very complex topic. But in short, we talked about nicotinamide mononucleotide and then nicotinamide riboside, which are the 2 big boosters of NAD, but those are oral and they don't work really well. They work partially, and they never, I have given it to a lot of my long COVID patients with very, very mild benefits. That's why we are entering a phase of NAD injections. Currently, for past 4 or 5 years, we've been offering them at the clinic as infusions. Very impractical, very expensive. 4 to 6 hours infusion, nobody can do it. Just really difficult, but very effective, treating any kind of fatigue. Well, actually, it's often reverses fatigue from one treatment. But you can give much lower dose just under the skin. It still has to be done in the clinic because there are some rare side effects, meaning fast heart rate. But it's much safer and it's easier, and it's going to cost a fraction, and it's instant. You come in, you get a shot, you leave, and you feel better in an hour or 2. So that's what the next. So next in our long COVID program is starting to try NAD, because some of the inflammatory controls we already implemented. We've been treating inflammation for quite some time. All right. Well, it's totally diverted me away from what I wanted to talk about. But Sharat, that was great. Thank you. Thanks and welcome again. I think it's important to talk about all this. Okay. So I was gonna actually, let me check the other questions. Any advice on using cold lasers for neuropathy and lymphedema? Yeah, sure. I mean, there's good data on that. Generally, when you go to PT and a lot of the regenerative practices, they're going to have that in the office. I tend to think that some of these devices, there's some evidence for them, but not very clear. There's tons of devices out there. Which ones are better? I don't know. I kind of generally, when somebody asks about it, what I do is I refer them to practices that actually physically use them. And so if you're interested, we can kind of take this offline. I don't want to spend a lot of time on that now. Okay. Kathy, did I understand correctly that if your health is over 65, who got COVID in October, last booster in June? Yeah, I wouldn't do anything now. There is no specific JN1 vaccine. I think that's what you're trying to ask. Unfortunately, no. And frankly, even if they come out with this tomorrow, I still wouldn't get it. It's too close. Remember, I'm really not advising people to get COVID shots more than every 6 months. We do think there's a harmful effects. They're slowly accumulating. COVID boosters seem to cause a short-lived inflammatory response after the vaccine. Long-term consequences are unclear. Minimize, just get what you need. Don't take too many shots. I think that would be totally inappropriate. And frankly, I will guarantee you, the JN1 cover will not come out for a while. But the current vaccines theoretically should cover the severity of JN1, just like it covered the severity of all prior Omicron variants. So, you consider acupuncture in the future as a treatment for what? For long COVID? It's not a future. We're treating almost every patient with long COVID with acupuncture, so it's already current treatment. It's not a future treatment, unless I misunderstood something. Yeah, no, it's a required treatment. It's one of the few things that works. We actually often do not acupuncture, but self-acupressure and self-moxa. People can buy a moxa sticks that are low smoke, and then learn which points they need to smoke 2-3 times a day. It works a lot better because you can do it very frequently. Some of the problems with acupuncture in China, they do it daily. It's impractical to do it daily. Too expensive, and nobody will advocate for it. But you can do daily acupressure. That's what most of our patients in long COVID programs do, whether acupressure or moxa, which is heating the acupuncture point. It's a slightly different principle, but it's same within the same model. Okay, well, great questions, you guys, to the point where I barely have time
question, Misha.
to do my topic. Yeah, what's the last
Can you hear
question?
me? Okay,
Yeah.
so it's a general question. For how long after one gets an average case of COVID, how long will they test positive? A friend insists it will be several weeks and that it doesn't comport.
That's right. Right.
Okay.
Great question. So it seems to be extremely variable. There are some people who will become negative very quickly. They clear the virus and they'll be negative right away. And some people tend to drag out the positivity even after they're completely symptom-free. Why that is, I'm not 100% clear. I'm guessing it depends on the original load of the virus, and I'm also guessing it depends on how quickly someone clears it from mucous membranes. There's a certain time frame. 5 to 10 days is probably an average. Question is really, what does it mean if you're completely symptom-free, but the test is positive? Are you safe to go out in public? And the answer in the past was absolutely not. But, the CDC tells the following: 10 days from the onset of symptoms or 5 days after the symptoms have ended, whichever comes first. And don't care about the result of the test. That's what CDC says. Now, are they right? Is every case who's going to be 10 days after, but they're still positive, completely not contagious? Probably not. Here's what I say. If the risk is very high and you test positive, don't expose other people. Like, let's say you have elderly parents and you're really afraid, don't go. Don't expose them. If you're not really worried about who's going to get it, you're in some general public area, you can wear a mask, probably okay. The point being is when you're going to be with the family and loved ones, you're going to be in probably for a long time in a very small space. You're not going to wear a mask. If you can wear a mask going somewhere and you're still testing positive, but you're completely symptom-free in 10 days, I'd probably be less worried. I hope that answers. I'm not sure if that was the question or not. Okay. All right. Can I do 5 minutes on my wellness talk that was supposed to be 15 minutes? But okay. So those of you who've been following our work at GW know that we've been strong advocates of Dr Sarno's work. So Dr Sarno is a founder of this principle called TMS, or this term, tension myositis or tension myalgia syndrome, depending on how you coin the term or how you look at it. Basically, he described thousands of cases of back pain that would have something on MRI, but it was non-surgical and the patient's not getting better. And he would treat this as a manifestation of chronic trauma or manifestation of some somatic component coming much more from psychological domain. And the treatment was going back in time, trying to figure out what is actually happening on more inner planes, clear it out, pain goes away. He wrote multiple bestseller books. I've had probably hundreds of patients with back pain. Just read the book and then pain goes away. And it's a pretty interesting approach. It's a deep mind-body approach that often says the following: stop everything you do. Stop acupuncture, stop massage, stop chiropractic, stop injection, stop everything. Because that distracts you. It takes away from you actually realizing why you have that back pain or the neck pain or the shoulder pain. And the key aspect of his work was, if I examine you and I don't really see anything pathologic except for some tension in the area that's hurting, that is TMS. And we should treat it with the mind-body approach only and nothing else. He was always a little controversial figure. We've featured him at one of our song symposiums. We featured him in a clinic. And so the reason I'm discussing this, I'm going to put something now in the, so this is the podcast that I just did with one of his core workers, with Dr. Segal. I hope to bring her onto our podcast here soon. But Dr. Segal has just recently published a book about John's life. And I'm going to give you a link to the book on Amazon, just in case anybody is interested. But the link is also in the link to the video. And the book is about John's life. So it covers all the principles of what he was doing. but it's also about his life, it's about his work, it's about his legacy. And really, basically the book actually called Breaking Out of Pain, Living the Legacy of Dr Sarno. So I'm going to give everybody a link to the book. Unfortunately, it is not available in Audible. That's my preferred way of, because I can crank it up to 1.5 and go through the book a lot faster while driving. But this is a great book. And the reason I think it's really good is if you ever have someone in your life, or you yourself, who have the pain syndrome that seems to be not getting better with anything, there's no clear pathology. And, you know, this is the exact approach that seems to work magic. Why I would rather you watch the video and then ask questions next week, because I think part of this requires a little slow thinking. When you're listening to me, it's very fast. Not only I speak fast, but I only have a couple of minutes to go into this. But the point of this is you need to analyze your own syndromes. You need to analyze your own symptoms to sense, is there a somatic component? And what I mean by somatic, it doesn't mean you're crazy. It doesn't mean it's in your head. What it means is that you're suppressing something on a psychological level that still needs to get addressed. And that being addressed comes to you as a physical symptom. It's somatizing. It moves from mental, from emotional, from spiritual domain into the physical domain of the pain. That's why we often say so strongly that the pain is a subjective experience, because not only we can't measure it, but it seems to vary, not based only that you have some lesion or some pressure or inflammation, but because there is a significant component of the psychological aspect enhancing, or the reverse, decreasing the syndrome based on other principles rather than pure pathology of the lesion, if there is any. And quite often, there's also this big topic we talked about, because this happens every day in everybody's practice. We have a patient coming in and say, look, I have a back pain because I have a compression, or because I have a lumbar stenosis, or I have a herniated disc and it's causing problems, because my surgeon told me so. Look at my MRI. And here's what I'll tell you. Often, that's a completely missed boat. They would say you have a lesion, gets operated, they operate, nothing happens. There's been research done when they would compare sham surgery. Patient goes under the knife, they'll cut the disc open, but they won't operate, they won't remove it. They'll suture patient back, they send him home, they're pain-free. They do the exactly same surgery, cut out a disc, same exact outcome. Not any better than sham. How do you explain this? TMS. This exact treatment that Sarno developed. Unfortunately, the Sarno's approach did not take off to the level that I would hope. And I think the obvious reason is this is not what generates the money in this healthcare system. What generates money is procedures, surgeries, injections, and they have to be justified. And so they're self-justifying. They keep creating studies showing that, yeah, the injections work, yeah, the surgery works, and they probably do work. I'm not denying that there are many cases where they're really important. What I'm trying to say is that shouldn't be the first level of treatment. The first level of treatment for most cases of back pain should be a movement therapy, possibly acupuncture, but first and foremost, a good evaluation with a provider who understands TMS principles. Unfortunately, there are very, very few of those. You here on the video, or today's Zoom, have a privilege to know that we have such a provider in our practice. So if that person is needed, I'm going to put the link to her practice there. And with that, I'll give you guys a minute to ask questions. I can't believe I just did this in 5 minutes, but yay me. And if you have a lot of questions and there's a lot of interest, I'm already trying to ask Dr. Segal to come and give us a bit more formal 15-20-minute talk about what she does. But meantime, I'll put the link to her practice in there. You can read there more, and also you have a link to the videos. So, but if anybody has 1 or 2 questions, let's do them before I yield a floor to our favorite yoga therapist, who somehow beat me after lunch together today to this event, even though she lives way further than me. I don't have any excuses except that I procrastinated walking my dogs, but that's okay. All right. Is the treatment just for back pain? Okay, great question. No, it's not just for back pain, it's for any pain. It could be a neck pain, it could be a shoulder pain, it could be a joint pain. Again, it depends on the cause of that pain. So if there is no clear underlying pathology underneath, then it's very possibly a TMS. Great question. Thank you for clarifying. Well, good. All right, Yael. Take the way.
I'm on.
You are.
I beat you because I took the bus and the bus driver was almost about to go through like a yellow light, and he spotted about 20 children and their 5 adults. And so on the bus ride home, I got to sit next to a little girl wearing a unicorn headband. And I think she just flew me to my DC apartment really quick. It was definitely a highlight of my day. And by the way, when something like that happens in your day, everyone here has heard of the word triggers. Like I got triggered by something someone said, or I read something online and I got triggered. What psychologists are talking about now, and it's I'm not going to explain where it comes from, but people are talking about glimmers and how finding moments in your day that are really positive and just allowing yourself to do that feel good work is really, really important also for long-term health. Not just mental health, but also physical health. So that was an example of a glimmer. And I'm hoping that the practice we do today might give you a little bit of that embodied feeling of things that make you feel good. And especially right now, there's so much really challenging things happening in the world. Some of us also are going through personally challenging times. And it's really important to always have different kind of tools in our toolbox. When I asked Janet what would be good for today, she suggested something which I think is really brilliant, which is loving kindness practice, which comes from really the Buddhist tradition. But we're just going to use it as a way of imagining. I mean, loving kindness, you could just think of love, or you could just think of kindness, of sort of sending ourselves and others good energy. I see one of my friends, Iva, just joined her camera on. Thank you. And what I thought I would do is not just offer a sort of kind of seated meditation, which is fine, but not 100% my jam. I thought that we would do kind of longer held poses while we're doing that work. So there's a practice in yoga called Yin Yoga, YIN. It's basically long held passive stretches. It targets the fascia, which I know for those of you that come here regularly, I know Niall talks a lot about the fascia. It's basically a system-wide or full body organ that helps transmit intelligence throughout our body and also light, which is maybe interesting as we're in dark times. And holding poses for 90 seconds to 5 minutes will actually begin to help remodel the fascia. So if we have parts of our body, like a good example is just frozen shoulder, if we have a part of our body that feels really stuck, then holding stretches for a longer time can begin to remodel that fascia so that you begin to feel a little bit more spaciousness. Good for all of us who are getting older, especially great for the joints. But recent studies also show that it acts as also an anti-inflammatory and anti-fibrotic, because when we're holding these poses for a long time, there's not just biomechanical changes, but also biochemical hormonal changes that happen. So what we're going to do, I'm going to change my seat. I'm just assuming that everybody can't quite see oh, yes, you can. You can't, well, I think you guys can see me here. I just, we're just going to do it in a chair. I'm going to recommend that if you're in a super cozy chair or a couch, you just don't sit like this. You don't do, I call that shlumpasana, that you sit a little bit more at the edge. And I'm short. I'm 5'1" if the doctor is feeling generous. So I have put just yoga blocks underneath my feet so that I've got about 90 degrees between my hips and my knees. Shlumpasana. Oh, good. I'm glad it's your favorite word. So, and so everything we're going to do today will either be in a chair. I think if it's okay with people, we might also do one thing at a wall. Would that be okay with folks? Okay, so we'll do that, just a little shoulder opener. Let's start either, you could be seated or standing. So if anyone wants to stand, just to do a little movement in the shoulders first. So I'm just going to encourage you, everyone, take your arms out to the side. And obviously, if only, if you've got issues with one side, it might just be one arm, right? And I'm just going to invite you to do just some gentle internal and external rotation, aka rolling your shoulder. So you're going to roll one shoulder forward and then the other. One shoulder folder and then the other. And then, of course, everything in the body is connected. So when I roll a shoulder forward, I almost can't help it. I lean towards the other side. If I wanted to, I could also look towards my open palm hand, right? So, is this yoga? Yes. Does yoga always have to be serious? No. You could be a little bit playful here. Good. And then we'll just kind of shake that out. Bring your fingertips to your, anywhere by your shoulders. And let's just draw some nice big circles. And I want to invite you to draw circles that are a little bit slower than you want them to be. Just so that you could really sense where things might get stuck for you. Which, by the way, is the reason why we do the loving kindness meditation. Let's turn around. Is because emotionally, maybe we're stuck in judging. And we know that it's much healthier for us and for everyone around us if we are in more of a space of trying to understand where people are coming from rather than judging them or blaming them. But we get stuck in these patterns. Good. Just release that for a second. Either keep your hands in your lap right now, just a half a minute of centering. Hands either in the lap, or if it's comfortable for you, you could take one or both hands to the heart, the spiritual heart, not necessarily the literal one. That's the center of the chest, right behind the breastbone. You don't have to close your eyes, but you can certainly gaze at something beautiful in the room or outside your room, as opposed to the screen. Or close your eyes and imagine that you're breathing in and out of the space around the heart. Just a few breaths right here. If you have your hands on your heart, you might even be able to feel the rhythm as the heart does its thing, just helping blood and oxygen and maybe energy circulate throughout the whole system, not get stuck. Good. So just notice when I use the word loving kindness or love or kindness, it's fine to pare things down, especially in January, to the essential. We've had a lot of big things last month. So if you want to keep it simple, just use one of those words, love or kindness. When you think about those words, can you actually embody them? Is there someone you love? Is there someone who has shown you kindness? Maybe even this week. And let yourself feel that love, that kindness in your body. And just notice what it does to you, how it makes you feel. Okay, friends, we're just going to take just one more breath here. Okay, and then let's go ahead, let's stand up, and we're going to come to a wall space. It could be like a bookshelf as well. I'm just going to come to my door here. And I know you can't quite see me, but I'm about this much, like maybe 6 inches or so away from my wall. I've got my right hip by the wall. I can either take my right arm anywhere from like a cactus arm, and I could also take it straight back behind me. So my right palm is on the wall. Rather than turn towards the wall, I'm going to gently open myself up a little bit away from the wall. So what I'm hoping is that you will feel just a little bit of openness through the front of the shoulder, through that heart area. Some of us might even want to bend that right knee and lean in. Some of us might even want to hold on to the wall with our left fingertips, with the hands that's away from the wall. We're just going to take a few breaths here, reminding ourselves that being loving beings can change everything. So I know I have lots of friends in the Zoom room who are what we used to lovingly call woo-woo. And some of us are maybe a little bit more scientifically based. I loved when I learned that when you take heart cells and you put them in a lab, in Petri dishes, in neighboring Petri dishes, or in many Petri dishes, the heart cells will begin to beat at the same rhythm. Good. Let's come away from the wall and we'll just go to the other side. So now my left hip is about, I don't know, 6 to 9 inches away from the wall. I'm going to take my left arm back behind me. It could be bent or it could be straight. I'm moving just a little bit towards the center of the wall until I can feel something right in the left side of the chest or right by that shoulder. I'm trying to move my shoulders away from my ears and just have a soft face and smooth breath. The moral of the story is if it works in a lab with Petri dishes, it works in our bodies anytime we're around people. And so trying to get ourselves into a space of loving kindness is not just good for us, it's excellent for our health, by the way. But it also can become a silent offering we make to the groups and families and communities that we're a part of all the time. Good, let's just take one more breath here. And then we'll come away from the wall. Just wanted, obviously both in Chinese medicine and in yoga, the area around the heart, the shoulders and the arms are very, very powerful in terms of loving kindness. So I'm hoping you feel even 2% of that freedom in this part of the body. Let's come to a seat now. And we're just going to do a couple of poses here. So again, sitting at the edge of your, kind of at the edge of your seat. And we're just going to take the right ankle and cross it over the left knee. So nothing too fancy. I'm already feeling a little something in my right hip. If I wanted to increase that, I could kind of lean forward. So feel free to do that to any extent. Feel free to close the eyes. We're actually really working in Chinese medicine with the gallbladder meridian here, which is related also to the liver meridian. And liver and gallbladder, when they're out of balance, they're really about anger in all of its forms. And love is what can dissipate it. So I'll just invite you to think about someone who it's very easy for you to love. It could be, it doesn't have to be a human. It could be your dog, your cat. It could be your partner, your child, a parent. And traditionally, there's short phrases that we say over and over, like, may you be happy, thinking about your person or being. May you be healthy. May you feel a sense of ease. May you be at peace. But it's also perfectly fine to really conjure that being and think about something about that being you love. And in any way that this makes sense to you, you could just send them that love that you feel for them. Okay. Let's just take one more breath here. And then we'll help ourselves up. So we're not holding for terribly long today, but hopefully long enough for you to feel that, yeah? And then let's cross the left ankle over and we'll just come to the other side. So you might be really upright here, or you might be coming down a little bit lower. And see what works for you. And maybe on this side, we can send loving kindness to a place. It could be a place that recharges us. A place where we go when we're not quite feeling ourselves, that reminds us of the best part of ourselves. Or it could be a place we visit occasionally, or we've been to once in our life, or maybe it's a dreamscape. In some ways, this loving kindness practice can be a little bit like just a Thanksgiving practice. You know, wishing that place or even the land, good health, ease, and peace. Good. One more full breath here, breathing in. And with the exhale, loving kindness. And we rise really slowly. Okay, last quick set that we're going to do. You could eat just a simple twist. So you could either come to an easy twist in your chair, coming to the right, and just because Dr. K loved the word so much, no shlumpasana, right? So we're going to sit up nice and tall. Another option, if it's okay for you, is you can pretend you're sitting at a bar stool, cross your right knee over your left, and then come into the twist. Again, that might make you feel it in the spine, but also in the hip. And I just have my right hand on the back of my chair and my left hand right by my knee. And here, maybe we'll just think about someone who's kind of neutral, like the bus driver, the Uber driver, the cashier. Although if you practice loving kindness all the way, you might actually feel very warm towards people, but they're not people in your immediate circle. Just someone that you often maybe is a neighbor, but all you do is wave at them. Just bring to mind someone that you feel kind of neutral about. And wish them well too. May you be happy. May you be healthy. May you feel a sense of ease. May you find peace. Friends. And then we're just gonna slowly unwind. And we'll just do our very last shape, just going to the other side. So, I would say either find another person that you feel neutral about, or if you're feeling up to it, someone who you find mildly irritating, not your arch enemy. I saw someone today that posts something on social media that I disliked. It caused me to roll my eyes. So I'm going to send this energy to her. May you be happy. May you be healthy. May you be at ease. May you be at peace. Or send that energy in any way that feels good. We can take one more breath here, and then slow, 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 come back through center. Maybe take both hands over your heart, or you could lightly touch your palms together at the center of the chest. And we can think something like, may all beings be happy. May all beings be healthy. May we all find a sense of ease. May peace prevail on earth. And with so much love and gratitude for everyone who made today possible for us, let's take one last inhale as a circle. And on the exhale to one another, we bow. Thank you, everybody.
Thank you, Yael, so much. Perfect timing. Everybody have a good weekend. It's going to be cold. If you're snow nuts like we are, maybe we'll see you at Whitetail. It should be open tomorrow. And who do we have next week, dear Janet?
We have Cynthia Powell.
Great. Oh, reminder. So we do have a 1-day, very low cost, $30 mindfulness retreat on January 21st. I'm so glad you said word Cynthia, because of course I only now remembered, even though I was supposed to advertise this, but now I am. So it's just give me 1 second, everybody, and I will give you a link to the retreat. Again, it's January 21st from 2 to 5 p.m. The link that I'm posting, you can use to register. Also, if you just go to gwcim.com, it's on the front, the link is on the front page. So, because it's in the news. So yeah, if you need a little bit of a renewal and a half a day time off of everything, by all means join. It is still within the MBSR framework, but it's just a much shorter one-time program. So with that, and who's doing the wellness talk? Me?
No, Cynthia is.
Oh, she's doing the whole thing?
She's
Okay,
doing
good.
the whole thing.
All right, well, I'll be there to do the quote as usual. Otherwise, stay warm. Bye. Thanks, Yael. It's great.
Oh, thank you. Bye, everybody.
Bye.